Hi, I'm Michael, and this is California. And on Thursday, Governor Gavin Newsom announced the new state budget cuts as a result of the lockdown and the pandemic, bringing us from the state's largest budget surplus in history down to $54 billion deficit. He said it would include cuts to health and human services, to homelessness, and to school districts if federal funding is not forthcoming. Specifically, he addressed the HEROES Act that came from Nancy Pelosi that has $1 trillion in funding for states like California. So today we're going to talk about how California is going to look with these new budget cuts, how it could affect Californians, and what it looks like for us in the near future. Now, if you like this information, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. The previous governor of California, Jerry Brown, got criticized a lot for squirreling away lots of money during the good times for the bad times. And he said that what's out there in the darkness is uncertainty, decline, and recession, referring to the potential disasters that could be on the horizon for the state. Now, Governor Gavin Newsom is feeling those potentialities. He is seeing what the effects of a pandemic or of a disaster could be on the state of California. And it makes sense now that the budgets have to be cut, considering there's so many people who are unemployment, businesses are closed, and business is not able to happen. Now, some of the main pain points of this are a 25% drop in personal income tax, a 20% drop in sales tax, a 22% drop in corporate tax, and an overall $41 billion loss in state revenue. So he has less money coming in. This is coupled with more expenses going out. For example, a $7 billion increase to health and human service programs as people coming out of their work health insurance are going to programs like medi-cal or Covered California. And additionally, a $6 billion increase in just general costs of running the government as a result of the pandemic, having masks and hand sanitizer and all the protective equipment necessary to keep employees safe. So we can see here that it's a double-edged sword. He's getting less money coming into the state revenue and more money coming out, which is going to have a dramatic effect on the California budget. So the new reduced California budget is specifically as a result of the deficit being 3.5 times larger than the $16 billion surplus the state currently has. And this means it's going to be cuts to the largest programs in the state, primarily schools as well as healthcare. And what this looks like for schools, for example, is an $18 billion decrease in schools from K through 12 and community college, even though they're having increased costs for every student, up to $400 per student, resulting in $24 billion more in cost as a result of the pandemic. So they're going to have a decrease of $18 billion. Additionally, for healthcare, programs like medi-cal, which covers 1 in 3 Californians, is going to go from 13 million people to 15 million people enrolled in the plan as a result of people coming out of their work insurance and going on to state insurance, or folks who always were eligible for it but are now more concerned about the program. In addition to Covered California, the health exchange, which also is seeing a large influx of people coming out of their work and going on to the health insurance through the Covered California program. Now, both these programs are going to experience cuts. So, for example, for medi-cal, they're going to have to reduce some of the benefits that got extended this year. So things like hearing aids, vision and foot care, eyeglasses, all of which are not federally mandated for the Medicaid program or Medi-cal here in California. Additionally, they're going to have to scroll back the plan to expand Medi-cal to undocumented seniors who are over the age of 65. On Covered California's side, there's going to have to be a decrease in the state subsidies that are offered to help reduce the cost for premiums for people's health insurance monthly. So needless to say, there is going to be a lot of cuts that are going to affect folks really hard as a result of this new revised budget. So the reality is we don't have to face these cuts in the California budget if we can get funding from the federal government. Now, unfortunately, the federal government, mainly being made up of the House, the Senate, and the White House and the Senate are currently under Republican control, and they don't have any appetite to do what they call a blue state bailout, where they're essentially going to give money to states like California that have cities like Los Angeles and San Francisco that are openly defiant of the federal government, of the federal administration, of the Trump administration, with things like sanctuary cities or more money for cannabis or what they see as overly generous public programs. So it doesn't look likely that they're going to give more money to the states because of those factors. Now, there is a bill currently, the HEROES Act, which has $1 trillion in it for states like California to help it stay afloat. But again, we'll have to see what the likelihood of that actually passing is. Now, here in California, a lot of California advocates are advocating for increases in taxes, mainly property taxes through Prop 13. So they're trying to change Prop 13 to allow California to tax people more for their real estate, for their property. So we'll have to see how that comes. But all this, unfortunately, could be avoided if things like the HEROES Act or something similar to the HEROES Act could get more money to states like California while they'll need it. The most saddening aspect of this whole thing is that Californians don't have to face these budget cuts, but it's become a political issue. But unfortunately, these senators and these governors and these presidents, they don't see the people on the ground. They don't hear the folks who are working in the health industry. They don't work with the folks who are in the low-income service industries, helping folks through this whole process now, while they're still, even with the current budget, they're hurting a lot. With a reduced budget, it's going to be even more. But it's devolved into a political contest between should states who don't have the exact ideological beliefs as the federal government be funded to help out real people. But reality is it's lost that the people who are being helped are Americans. They're folks who need the money now. They need the extra help, and they don't need cuts in their benefits. So I hope that whatever works out, whether it's the HEROES Act or some other sort of act that gets money to states, that they're able to reach an agreement to get money out to folks when they need it most. Thank you so much for watching our video today. If you found it interesting, you found it helpful, you found it useful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments, you have any questions, feel free to put them down below. We love to see your comments and questions. We'll be happy to answer them or make new videos or make new posts to go over them as soon as we can. Also, we here at California, we know health insurance. So whether it's private health insurance or Covered California or Medicare or Medicaid or Medi-cal or even health insurance for a small group, we know health insurance. And our services are 100% free for anybody here in California. So if you do have questions about your health insurance, I know it can be really frustrating if you're going from your work insurance down to private health insurance, or maybe you're turning 65 and you're trying to figure out what your Medicare options are. We can help you look at the plans that are available, the benefits, and everything that fits into your budget and which one fits best for you. So please reach out to us if you have a question about your health insurance. Now, other than that, I am Michael, and this is California wishing you a happy, healthy day.